Welcome to our presentation. Today we will be talking about exercising with Parkinson's disease. This will be presented by Kate, Kyle, Taylor, and myself, Jamie. Who are we, you ask? We are third-year ETSU physical therapy students just wanting to provide some information about exercising with Parkinson's. This is a photo of us. To begin the presentation, I'd like to discuss a Parkinson's disease overview. Parkinson's disease is a progressive disease of the nervous system associated with low levels of dopamine due to decreased production in the brain. Dopamine plays a role in memory, movement, motivation, mood, attention, and on. It is primarily known as a movement disorder in which a tremor, which is trembling in the hands, arms, and legs or the jaw, is the most common initial symptom. Next, we will talk about the symptoms of Parkinson's disease. Parkinson's causes unintended or uncontrollable movements, such as shaking, stiffness, and difficulty with balance and coordination. There are 4 hallmark symptoms of Parkinson's. These include rigidity, which is stiffness of the limbs, bradykinesia, which is slowness of movement, flexed posture, and impaired balance and coordination. This is another slide of common symptoms of Parkinson's disease. If you look at the picture of the man on the left, these are all common symptoms that you might see in someone with Parkinson's disease. These include a stooped posture, back rigidity, flexed elbows and wrists, tremors in the legs, masked face, forward tilt of the trunk, reduced arm swing, hand tremor, slightly flexed hip and knees, and shuffling short stepped gait pattern. Next, we will talk about Parkinsonism. Parkinsonism is simply a term used for the collection of signs and symptoms found in Parkinson's disease, which include bradykinesia, meaning slowness, rigidity, meaning stiffness, tremor, and imbalance, meaning postural instability. Other conditions can have these symptoms which mimic Parkinson's, including idiopathic Parkinson's and other atypical Parkinsonism disorders. Let's talk about Parkinson's disease progression. Keep in mind that Parkinson's will affect each individual differently. Not everyone will experience all of these symptoms, and not everyone will experience them in this particular order. Stage 1 of Parkinson's includes mild symptoms that generally do not interfere with daily activities. Stage 2 includes a tremor, rigidity, and other movement symptoms that affect both sides of the body. It also includes walking problems and poor posture. Stage 3 includes a loss of balance and slowness of movements. Falls are more common, and symptoms impair activities such as dressing and eating. In stage 4, symptoms are severe and limiting. The person is typically unable to live alone and requires assistance with activities of daily living. Stage 5 is the most advanced stage of Parkinson's disease. It includes leg stiffness that may make it extremely difficult to walk, and the person typically requires a wheelchair and needs help with all daily activities.
The good news is exercise can help. Exercise is a vital component in maintaining your level of balance, mobility, and your activities of daily living. Exercise and physical activity can improve many of the Parkinson's symptoms that may occur. The Parkinson's Outcomes Project shows that people with Parkinson's who start exercising earlier and a minimum of 2.5 hours a week experience a slower decline in their quality of life compared to those who start later or don't start at all. There are multiple types of exercise: aerobic activity, strength training, balance, agility, and multitasking, as well as flexibility, are all key components to an exercise program that is aimed at managing the symptoms of Parkinson's disease. Just a few tips to help get you started. Be safe when you're doing any type of exercise. Consider seeing a physical therapist that specializes in Parkinson's to receive recommendations on exercises for you. Use a pedometer or step counter and simply try to slowly increase your steps, either by day or by week, however you see fit for you. Exercise inside and outside to stay interested and motivated. And make sure to pick an exercise you enjoy so you're having fun while you're doing it, and exercise doesn't seem just like this daunting task. It's a fun thing you want to do every single day. While not all of you may currently participate in structured classes designed for individuals with Parkinson's or even participate in exercise at home, we hope by the end of this presentation that you'll be encouraged and be looking forward to finding exercises that fit you and what you need in everyday life. As mentioned earlier, Parkinson's is a progressive disease of the nervous system that can have effect on many different activities you may try to perform throughout the day. Studies have shown that individuals who complete exercise and physical activity can have an improvement of many of their motor and non-motor symptoms that have occurred with Parkinson's. Here are the recommendations for each of the types of exercise mentioned earlier. For aerobic activity, it's recommended to do 3 days a week for at least 30 minutes per session of continuous or intermittent at moderate to vigorous intensity levels. Types of aerobic activity include brisk walking, running, cycling, swimming, or an aerobics class. Supervision may be required during this activity due to safety concerns of freezing gait, low blood pressure, or a blunted heart rate response to the aerobic activity. The next is strength training. This is recommended 2 to 3 non-consecutive days a week for at least 30 minutes per session of 10 to 15 reps for major muscle groups. Types of strength training include the major muscle groups of upper and lower extremities using things such as the weight machines, resisted bands, light or moderate handheld weights, or just your body weight. Some considerations for strength training are muscle stiffness and postural instability that may hinder being able to achieve full range of motion during this training. The next is balance, agility, and multitasking. This is recommended for 2 to 3 days a week with daily integration if possible. Types of balance, agility, and multitasking training include multidirectional stepping, weight shifting, dynamic balance activities, large movements, and multitasking exercises such as yoga, tai chi, dance, and boxing. Considerations with this are safety concerns with possible cognitive and balance deficits. Hold on to something stable as needed to be more safe, and supervision may also be required for this activity due to the dynamic nature of it. The last one is stretching. This is recommended at least 2 to 3 days, if not more, with daily being the most effective. Types of stretching include sustained stretching with deep breathing or dynamic stretching before you complete other exercise. Some considerations that you may require adaptations for flexed posture or osteoporosis and pain. The Parkinson's Foundation suggests the following for individuals with Parkinson's disease. See a physical therapist that specializes in Parkinson's for a full functional evaluation and to receive recommendations from them. Always consider your safety first. Exercise during on periods when taking your medication to get the best effect and be the most safe. If it is not safe to exercise on your own, have someone with you to assist. It is important to modify and progress your exercise routine over time. You don't want to just start out doing a lot of exercise all at once. You want to gradually increase as time continues. Participate in 150 minutes of moderate to vigorous exercise per week to have the best effect from exercise.
In this section, I'm going to be explaining a little bit of background information, pros, and cons to each of the exercise classes. Please note that the links to the videos below are located in the comments section of this YouTube video. So, a little bit about Rocksteady Boxing. This is a class that emphasizes the importance of performing gross motor movement, balance, core strengthening, and rhythm to help improve overall range of motion, flexibility, posture, gait, and activities of daily living. Some of the pros to this program is that it helps with increased self-confidence, it helps to relieve overall stress levels, brings a sense of community, is thought to be neuroprotective, and helps improve overall quality of life. Some of the cons to this program is that it requires higher endurance levels, requires increased balance skill, can cause increased muscle soreness, and has multiple people to one instructor, which means there's less supervision or assistance to each individual person. The LSVT Big and Loud program is a structured program that focuses on large movements and using a loud voice to deter the progression of Parkinson's disease. These larger than normal movements and louder voices help the individual learn to recalibrate how their movements and voice is perceived by themselves. Some of the pros to this program is that it helps with improved quality of movements, increases overall range of motion, increases strength gains, helps with increased endurance levels, and is instructed by a PT or an OT via one-on-one individualized sessions. Some of the cons to this program is that it has an increased time commitment, usually about 4 lessons a week and homework for about 4 weeks, and you must go to a PT or an OT and have an evaluation first. Tai Chi and Yoga. Tai Chi is a form of moving meditation involving continuous flowing movements. Yoga uses various body postures and movements, along with breath control and meditation. The pros of these programs include promoting relaxation, increased awareness of movement and action, better awareness of proper body alignment and posture, and enhanced flexibility, improved balance and core strength, which helps to reduce overall fall risk, improved breath support and control, and the poses can be modified as needed. The cons to these programs include increased balance requirement, difficult to learn on your own or practice independently, there's a possible risk of injury or falls, you're often unable to practice traditional poses, you can have increased anxiety from trying to get into a pose, and this is typically not a one-on-one instruction or supervision.
Now we will talk about safety. You always want to practice safety while you're exercising. You first want to talk to your doctor or physical therapist before starting a home exercise program. When exercising, you need to follow these recommendations. Keep your exercise area free from clutter to decrease the risk of tripping or falling. Ease into exercising, so start small and then build your way up to more exercise. Always make sure that you have a chair nearby in case you need to sit down to rest. Always wear shoes for increased stability. Stay hydrated and avoid exercising in excessive hot or cold weather. It's also good to have someone present with you while you're exercising, but if not, just follow these recommendations. The next slide will talk about home exercise program examples. The following photos are photos of exercises that you can do at home, and they all involve a chair for safety. I will be going through the photos from left to right. The first photo is of someone doing shoulder blade squeezes. For this exercise, you will squeeze your shoulder blades together and then relax. The next photo is of someone sitting in a chair with their knees bent. You will then straighten your leg and bring it back down to the bent position and then repeat. The next photo is of someone standing behind the chair and moving their leg backwards and forwards while keeping their legs straight. The bottom left photo is of someone holding on to the back of the chair and doing a mini squat. So you will squat down a little and then come back up to a straight position. The next one is holding on to the chair and lifting your toes up and then back down. And then the last one is kind of the opposite of the one we talked about before, and it's going up on your toes and back down. And as always, please keep safety in mind while performing these exercises. Now we will talk a little bit about medication. So, medication cannot cure Parkinson's disease, but it can help treat the symptoms, which could be very beneficial. Each person must be individually evaluated to determine which drug or combination of drugs is best for them. So, your medications can always be adjusted by your physician if they seem to not be working as well as they should be. Medications may have interactions with food, other medications you're taking, vitamins, herbal supplements, and over the counter pills, and other things of that nature. And medication dosing is outside the scope of physical therapy. So, if you have any concerns about your medications and their effects, you will need to talk to your physician or pharmacist about that. We have made a handout that summarizes our presentation today that has information about local resources and contacts for exercising with Parkinson's disease. I have emailed the handout to Miss Sandra. This concludes our presentation. Thank you so much for listening to our presentation today. I hope that it was helpful. And if you have any questions or comments, please feel free to email me. Also, if you do not mind, we would love feedback on our presentation, like what you liked and what you did not like, or if you learned anything. So please let us know by email. Miss Sandra has my contact information, so you can contact me at any time. Thank you again for listening to us.